Well, my first reflection on 75 years of the NHS is that I've worked in the NHS for over half of it, which is terrifying. But 75 years, well, what has changed in 75 years? So there are people, still able to tell us what that first day on the 5th of July 1948 was like. And what they will tell you in the years beforehand, it was difficult to access medical care. It cost money, so not everybody came forward when they needed to. And just on that day, things flipped, and there was a transformation. People were able to come forward, they were able to be seen and have their illnesses treated, and everybody who tells you those stories will say what a remarkable difference it was in the years after. But of course, 75 years, goodness me, haven't we seen some changes? It's hard to believe, but in 1948 we didn't know that smoking caused lung cancer. That was in the 1950s. Richard Dole, the epidemiologist in Oxford. We didn't have organ transplantation. I'm a kidney doctor. My specialty was kidney transplantation. That wasn't around in 1948. That came in the 1950s, and in the UK. It was first in the States in the 1960s in the UK. We didn't have an organ donation register. We didn't have defibrillators for when you have a heart attack. We didn't have MRI scanners or CT scanners. We just had X-rays. We didn't have genetics. It wasn't until the 1950s that the structure of DNA was elucidated. So we knew very little about DNA and genes and how they affect disease.